Okay, good morning everybody. John Ward, Director of Emergency Management, coming here from the Unified Command Center where we're responding to COVID-19 here in Clay County. Day 50. Your Clay team's been activated for now 50 days straight, working with our partners from all our first responders, our health department partners, and many others that have been working long, tireless days for the past 50 days. I'd like to thank both them and their families for what they've been dealing with over the past 50 days with their partners being away and struggling with the new norm at their own household. And I'd also like to take this time to thank my wife and kids who are administrators and seniors within the school district learning that new norm and those challenges. I do want to talk about a couple great things that your Clay team has been doing throughout this process as we've been responding. One, I'm going to say we're very proud that we were one of the few counties in North Florida to keep our parks and our boat ramps open. We kept the park green spaces open because we knew this was going to be a long-term event and we wanted to give the ability for our residents to get out and enjoy our beautiful green spaces that we've had. I do also want to say, as I say every time, we've had great collaboration with this unprecedented event with our Department of Health. Heather, the health administrator, has been sitting across from me for the past 50 days. I'm surprised she's still sitting there, but we've had great collaboration and great information sharing as we've been moving on. We leaned forward early, realizing the human services lift that we were going to have here within the county, and knew it was going to grow significantly so we could help our citizens. We stood up a warehouse operation very early. This warehouse operation was twofold. It was able to receive the small quantities of PPE for our nursing home facilities and our assisted living facilities, and then later on that week it also started receiving food from the state and federal partners for our food banks, and we were able to package that down and deliver it to them. We've now stood up a food boxing mission with the increase of that demand, and many of our citizens, due to unemployment, due to lack of pay, whatever it may be, we're seeing that food need rise. So this week we started what I'm going to call a food box operation. We receive multiple truckloads of food in, or we go get it, and then we actually box it into 7-day meal boxes here, and then it's distributed out to our various areas. With the need growing, when we have to speak with our state partners and we're ordering this food, you've got to justify it with numbers. So our human services team developed an app, and this is where you go to the alert.claycountygov.com and you can sign up for those foods, and it gives you a barcode. What this does is it justifies our number to the state when we're ordering that food and the commodities, because they have grown significantly over the past few weeks. As that need grows, we're prepared to continually grow this mission to support our citizens. I've told my human services team that this mission is going to continue to grow, and that probably it'll be prepared through the end of June to continue this operation. Once we do the full opening back, it's not going to be a light switch. It's not going to be turned back on, and everybody's not going to be back to work with paychecks coming in, so we're prepared to support that. The other thing I want to say is Heather recognized early that our facilities were beginning to see cases, and that she needed to get additional assistance into the county. So she requested nursing teams to come into the facilities, retrain them on the proper use of PPE, and do the facility assessments. And that's where the incident management team is now based out of our county. And the region has 30 nurses, 5 ambulance teams, and 5 teams of National Guard assets that are here replicating across the region what Clay County did early on. Now these assets are able to be used across the region in other facilities that are experiencing issues. We'd like to thank all the team members that are here. These teams from the management team that's here at the Emergency Operations Center is made up of folks from all over Northeast Florida, various agency partners, and I'd like to thank them, and I'd like to thank their agency heads for allowing them to be a part of this. So now let's talk reopening, rehiring, and reuniting Clay County. We need to focus on facts, not fear. We all watched yesterday with the governor unveiled his opening Florida plan, and we're now ready to enter phase 1 of the president's plan and begin the recovery process. 2 executive orders were placed out yesterday evening. One was Executive Order 20-111, and that's really to just increases the limited movement until Monday. The original executive order ended today. That just kind of carries that on until Monday. The governor's executive order 20-112 is the Safe, Smart, step-by-step plan for Florida's recovery. Beginning Monday, May 4th, we're still suggesting limited interactions outside of your home. Indoor seating can happen at 25% of their capacity. And again, we're still going to practice our physical distancing in between tables. Our in-store passes, and that's what's been the challenge. That's what we've all seen, is that supply chain is very slow because it's been a worldwide thing. So that's going to be the challenge taking forward. Nursing home facilities. Our nursing home facilities and assisted living facilities are still not allowed to have visitors inside them, and this is to avoid any asymptomatic. I speak with my hairstylist on a regular basis and know what type of how it's impacting small businesses, and trust me, I can't wait to sit in that chair. The crisis has changed the way we look at the center is where you call in to report that you're in need of food, you'd like to volunteer for any of our services, or you just have questions about the safety and what's going on here. That number is 877-252-9362. And that is open Monday through Friday, 8 to 5. So far to date, this call center's fielded 5,593 questions for service through that call center. And please be sure also you can go to the alert.claycountygov.com for the correct information. On our human services side, we've received many very generous donations to help us purchase food, commodities for our citizens. We've received those donations from, I'd like to thank Sam's Club, the Clay County Care Association, Five Star Credit Union, George and Ann Egan of the Egan Family Fund and Community Foundation of Northeast Florida, the Town of Orange Park, and the Winn-Dixie Gives Foundation for donating money to help us purchase food to the respective areas. Food assistance. In addition to the outstanding food banks that we have locally, we've now stood up 5 what I'm going to call food distribution centers, because they're kind of growing outside that model of what a food bank is. These locations are Celebration Church in Orange Park, and they do their distribution from Wednesday from 10 a.m. to noon. Church at 1122 in Fleming Island, and they're open from Thursdays from 3 to 4. First Baptist Church of Middleburg, and they're Thursdays noon to 1. Keystone Safety Net will be at McCrae Elementary School from Wednesday from 5 to 7 p.m. And then Springs Church in Orange Park is on Fridays from 11 to noon. And again, go to the alert.claycountygov.com to register for food assistance. To date, from March 13th till today, the food banks have served over 425,000 meals. Schools, for their feeding program, have served over 56,000 meals. And our senior centers, feeding our valuable seniors, have served over 7,000 meals, totaling to date 488,587 meals that have been fed to our citizens. We have the Clay County Chamber of Commerce is working diligently on assisting us in collecting money to continually buy our food for this. If you'd like to help raise funds for this, if you go to theclaychamber.com, and they've established a fund that can be donated to, and then they will bring that to us so we can help purchase the canned goods and stuff for our folks. The Clay Chamber is also working with our businesses. As I stated early on, we have many businesses that have been impacted in this time of being shut down. So please, there's many programs available through the SBA. And you go to the claychamber.com and you can register for their webinars and their information they have on businesses. So let's talk testing. Clay County now is going to begin testing for COVID-19. Over the past 6 weeks, we've seen a major strain on both testing swabs and PPE. Those allotments have not been there to stand up sites. For every site we stand up, it takes a lot amount of PPE to keep our first responders and our citizens safe as we're doing this. That's why you saw that model of the 3 federal models, and then which is now the 3 state-supported models that are in Miami, Orlando, and Jacksonville at the Jaguar Stadium. Now that more PPE is coming available, and now that more testing swabs are coming available, we can now work to increase testing capacity, which is just as the governor spoke of and just as the president spoke of, so we know what's truly in our community. We know there's a lot of asymptomatic cases that are out there, so we really need to start getting a pulse check of what's out there. So starting next week, we're going to be testing to find cases in the community. There's no fever. You're going to have the signs and symptoms of that, and you must be a Clay County resident. We're going to have 5 sites that we're going to be working with over the next 2 weeks, and residents wishing to be tested must be symptomatic, bring their ID and their own PIN. And I just want to caveat with, as we're testing, we know numbers are going to increase. But the cases are already into the community. Many of them are asymptomatic. These testing sites are going to be by appointment only, and they're going to be 10-minute appointments, is how this is going to work. And to get those appointments, you will call 877-252-9362. And these will also be weather dependent. If you do not have an appointment and you show up there, you will not be tested. You will be turned away. Our sites are going to be as follows. In Keystone Heights, it's going to be at the Little Rain Lake Park, beginning Monday and Tuesday, May 4th and 5th. And that'll be from 8 a.m. to 12 p.m. We'll have a Middleburg site, which will be Omega Park. And that'll be Wednesday and Thursday, May 6th and 7th. And again, that'll be 8 a.m. to 12 p.m. In Green Cove Springs, we're going to be at the county admin staff parking lot, and that'll be Friday and Monday, May 8th and 11th, from 8 a.m. to 12 p.m. And then in Orange Park, we're going to be at the Walter Odom Park, which is considered Bell Med to some, on Thursday and Friday, May 14th and 15th, again from 8 a.m. to 12 p.m. Clay County, please remain calm and informed as we reopen, rehire, and reunite Clay County. Clay County, thank you for the opportunity to serve, and thank you for being Clay County strong. I'm now going to turn it over to Ms. Heather Huffman.
Thank you, John, and it's been a pleasure sitting across from you for 50 days. So just to give you a little bit of numbers, as I always do with data, as of this morning, we're at 271 cases. 273. 271 of those cases are Florida residents, 2 are non-residents. We currently do have 15 deaths, and we continue to look at that mortality rate. We've been unfortunate in our communities that it has hit some of our most vulnerable, and that's why our mortality rate is where it's at. We've had 63 hospitalizations of those 273 individuals, and that means ever hospitalized, not currently hospitalized. We've had a total of 3,700 tests done, with 3,400, a little over 3,400 of those being negative, which leads us to around about a 7.3 positivity rate. You've heard the Trump administration and Governor DeSantis talk about positivity rate. So as we look at testing, as John spoke about, and testing more, we're going to get more cases, but we're hoping to, again, look at that positivity rate with the amount of testing that we're doing each day, and keeping it lower and lower and lower is what we're looking for. So John talked about testing that's coming up in the community. Some of the struggles that we've had over the last 6 weeks he mentioned, not only with swabbing capabilities and testing availability and PPE availability, we also had lab capacity issues. So we could do lots and lots of tests, but the problem is if we didn't have the lab capacity, it would take weeks to get those results back because it would just backlog those labs. So one of our goals now is not only to do the testing, but have quick turnaround times. And I know Governor DeSantis talked about that yesterday. We want to make sure that we're getting those results in 24 to 48 hours so that we can identify those individuals that are positive, we can isolate them, and then any contacts that we can come in, that they've been in contact with, we can interview them and isolate them also, and then recommend them for testing. That's where you're going to hear that lots of conversations about contact tracing. That's the important work that the Public Health Department does with epidemiology. The Harvard University recommends about 150 tests per day for 100,000. We've been testing on average, and our highest day was back on the 17th, of about 251 individuals. We would like to get between 150 to 200 individuals a day to get a good number. I'll give you an example. On the 29th, the maximum that we had tested was 77. So we want to double that number, and that's why we're bringing testing into our community so that we can identify these individuals that are probably asymptomatic, because I would believe that people that are symptomatic are probably searching out for that testing and care from their physicians. One of the reasons that we've chosen those testing locations is because we believe that maybe there has been some transportation disadvantaged individuals that have not had the capabilities because of the lack of work, the lack of income, to be able to go all the way to Jacksonville for that testing. And so we're bringing the testing to those communities so that individuals will have an opportunity to be able to get that testing. And then lastly, I want to talk about the long-term care facilities. We continue to work with those facilities. We have 28 to 29 facilities in our community that we work with that are ALS nursing homes that care for some of our most vulnerable. We are currently doing 3 times a week call downs, individual call downs to those facilities to speak to their administrators, director of nursing, to ask them about questions about their PPE needs, their education needs, what are the signs and symptoms that they're facing with their staff, their residents, are they doing proper screening of their staff coming in, and just having those one-on-one conversations. We just feel like it's not only provide information, but we are also to receive information with them so that we can have a collaborative effort to take care of these individuals. And at this point, I will turn over the final to Mr. Howard Wanamaker, the County Manager.
Okay, good morning, ladies and gentlemen. Thank you, Heather. Thank you, John. Lots of great information as we move through day 50 into many more days ahead. Thank you to each of you, to our first responders, doctors, nurses, health department staff, to county employees, to business owners, to every resident. You are doing your part to reduce the spread of this coronavirus. Yesterday, Governor DeSantis briefed us on Florida's plan to reopen, following President Trump's gating and 3-phase approach. Based on the data, facts, and your vigilance, we have met the cases, symptoms, and hospitalization gating criteria and are able to enter phase 1 on Monday, May 4th. This safe, smart, step-by-step plan will begin with us moving into phase 1 at quarter speed and will be re-examined in the days and weeks ahead to achieve full speed. Restaurants and retail businesses are able to accommodate customers indoors at 25% capacity, and elective surgeries may resume. Please continue to follow CDC guidance on physical distancing and social gathering. We must remain vigilant, and together we will reopen, rehire, and reunite Clay County. Thank you all. Now we'll open for some questions.
That'd be me, I guess. So I know that you talked about the executive order expiring, the governor taking that away. Earlier this month, we were standing here and y'all were saying 6 to 8 weeks. Is there any particular reason, apart from the cases, that you guys feel comfortable and have moved forward with this quarter reopening, even though you are expecting more cases to pop up?
I think, when you look at it, the increase in testing will produce more positives. So there's no doubt, the more you test. But I think when you look at those other criteria that are out there, hospitalizations, deaths, and the death rate, and that, the data that was presented yesterday by the governor clearly shows that Florida is ready to begin phase 1 in reopening. And I think together, we've worked together, both with the health department and emergency management, to become comfortable and feel comfortable on reopening. Heather, did you want to mention something?
Yeah, just again, I think the governor was really stressed this. It's not, we are going to find more cases. It's looking at that positivity rate. So we, again, on average are having about a 7.3% positivity rate in here, but we've been testing low numbers. And so we want to test more, and we hope that positivity rate actually goes down. Again, as we're reopening, it's really important to identify those individuals so that we can isolate them, but also do contact tracing. That's the really important work of public health.
Looking down the road, how long do you guys expect to stay in this quarter opening phase before moving through to the next, or what is that based on for you guys?
Sure. So daily we'll talk about it, we'll examine the numbers and discuss it. And moving into phase 2 would probably get us up to maybe half speed and further. in looking at the president's three-phased approach and following that, we anticipate that the state of Florida would move into a phase 2, and we follow that guidance and that additional guidance that's there. Obviously, to lessen those restrictions on our businesses and the movement of folks and increase those social gatherings would be within the next phase that we look at.
What type of law enforcement or enforcing efforts are we going to see as far as the 25% capacity for restaurants and whatnot?
Sure, I think, once again, I mean, the enforcement is out there with law enforcement, and as briefed yesterday, it is still a misdemeanor and not heeding that guidance. But again, it comes to personal responsibility. It's each and every one of us to check whether we're doing the right thing. Only that individual knows what they need, whether it comes to groceries and going out, to picking up medications, to sitting at the restaurant and not being too close. Just standing next to Heather, I wanted to make sure I was approximately 6 feet away. So it takes each and every one of us to look at that and work together.
As far as the 15 deaths that you mentioned here in Clay County, are the majority in nursing homes?
I'll let Heather talk about those numbers.
So we don't really go into that. I will tell you that we have had some. No one has died in the nursing home. Most of them have been transported and they've gone to the hospital. Unfortunately, that is where our most vulnerable are. They because of age, but they also have a lot of comorbidities, a lot of underlying health conditions. And so it does impact them mostly, that's why we're trying to protect those long-term care facilities. That's why the governor still has that stay-at-home order for those individuals that have underlying health conditions and those 65 or older. Because if we look at our death percentages based on age, ours are in the upper bracket age range. Okay, thank you so much.
Thank you all.